Hi, I'm Dr. Mark Poray, a family and sports chiropractor in Brooklyn, Ontario. Today I'd like to talk about how chiropractic fits into the healthcare system. It's probably something everybody's trying to figure out these days. Chiropractic is actually the largest alternative healthcare system in the world. Certainly in Ontario and in most of Canada, chiropractors are officially considered to be doctors. There are 5 groups that are recognized in this way officially. There are psychologists, dentists, veterinarians, allopathic, and chiropractic physicians. So allopathic physicians are your family doctors, and chiropractors are people like myself. Now, allopathic and chiropractic doctors are both considered portals of entry into the healthcare system and don't require referrals. In cases of motor vehicle accidents or workmen's safety insurance board cases, you are permitted to see either one in order to access your insurance coverage. The reason for this is what's called scope of practice. That means that the academic training of both allopathic and chiropractic doctors in Ontario is virtually identical. The same courses, the same number of hours, that sort of thing. The major difference lies in the philosophical approach to healthcare and the actual delivery of the treatments. Where the allopathic approach is centered around pharmaceuticals and surgery, the chiropractic approach is based on correcting the nerve supply from the spine and prevention. So the chiropractic approach is more proactive and the allopathic approach is more reactive, in my opinion. The allopathic approach has tended to be symptom-based, while the chiropractic approach tends more to cause and holism. For many years, there was a great deal of misunderstanding between the two professions, each thinking their approach was the more appropriate. These days, there's far more cooperation between the two, and there are very many offices where you can find both kinds of doctors interacting with each other, and they freely refer patients back and forth depending on the patient's particular needs. There are even many hospitals now these days where there are chiropractors consulting on patient care. Unfortunately, one of the key differences between the two is that allopathic care has OHIP support, while chiropractic care now depends on a fee-for-service approach. Luckily, many extended healthcare plans will cover chiropractic either in full or in part. That's something that you need to check on with your own particular program. These days, the informed patient has looked into both systems and created a healthcare team for themselves. If they're fortunate, their chiropractor and their family doctor both understand the need for care from the other at times, and either do not object or in fact encourage visits to the other when their approach is not as good. There are even times when both can collaborate on the same problem. Sometimes I'll find that a patient's problem includes inflammation and muscle spasms and pain that simply will not permit a traditional chiropractic approach or a chiropractic adjustment until those things are looked after. In those cases, I encourage my patients to consult with their family doctor to get over that hump before we continue. Another concern many patients have is the effect of continued use of drugs on their overall health and some of the side effects associated with many of the medications. These people have decided to make chiropractors their primary family doctor. Obviously, there are cases where allopathic or the heroic approach is more appropriate, and a hospital environment is the best way. Fractures, serious lacerations, hyperbaric injuries, brain injuries, and serious acute diseases are examples of this. One of the things that patients have said they prefer about chiropractors is their hands-on approach and the chiropractor's willingness to listen to the whole story of their problem. They find that their family doctors are so overwhelmed by the patient volume in their offices that they don't have time to listen, and they're too quick to respond with the quick fix prescriptions, rather, regardless of the particular complaint. One of the problems with our current system is that while chiropractors can refer people out for x-rays and some lab tests, we can't refer people for specialty lab tests like MRIs and ultrasounds. While we can refer people to medical specialists, most won't take our referrals because OHIP will not pay as much for a referral from a chiropractor as it will from an MD. This can create a bottleneck in the healthcare delivery system because we have to send the patient to their family doctor, who may have to reorder lab tests and who can then refer them on to the specialist. That's a real problem with the healthcare system as we have it now. The chiropractic approach, or the hands-on approach, however, has the advantage that once the chiropractor has made the diagnosis, he or she can immediately implement the treatment required, whereas the family doctor, who will have to may have to send the patient out for therapy. So this brings up the problem some people have about deciding whether they want to see a physiotherapist or a chiropractor for the delivery of their care. How to decide? Very often the delivery of the care is very similar and the patient is in a dilemma. So the difference is that by law, chiropractors can make a diagnosis and deliver the care, whereas the physiotherapist depends on a diagnosis to be made from the referring doctor before they treat. Now, depending on the condition, I will sometimes send a patient to a physiotherapist because I feel that they have the equipment that's better suited to their particular therapy, or they may be able to devote more time to that particular type of care. I've also had physiotherapists send patients back to me, so that's worked out very nicely when there's cooperation between the professions. So what a wise healthcare consumer should do is to have the best health care for themselves and for their family, and they can accomplish this not necessarily by choosing between a chiropractor and a family doctor, but rather creating a health care team for themselves, with one to be their go-to caregiver, the one who can easily refer them out for care, for the care that they need quickly without biases built on old stereotypes. There are advantages to either approach to healthcare, but isn't it better to have both rather than one or the other? I'm Dr. Mark Poray. You can find more of my blogs on specific conditions on this website, www.drporay.com. There's also more information about our other services at the Brooklyn Family Health Center. We're located on Highway 12 between Whitby and Brooklyn, right beside the Lindbrook Golf Course. For an appointment to discuss your healthcare problems, please give us a call at 905-655-5767. Thanks.